का सर ने मुझे बोला कि तुम्हारे कॉलेज के लिए सेमिनार लेंगे। मेरे कॉलेज के लिए पहला स्पीकर ऐसा है कि जिन्होंने होके मुझे कहा कि मैं तुम्हारे लिए सेमिनार लूंगा। ये बहुत हमारे लिए गर्व की बात है सर। और इस बात के लिए मैं सर आपको बहुत धन्यवाद देती हूँ। सर जो है ये पटना होम्योपैथी मेडिकल कॉलेज में रेपटी में प्रोफेसर थे। और जो इंटरनेशनल फोरम चलता है उसी में 9020 सेमिनार अभी तक ले चुके हैं। रोज सेमिनार, रोज वेबिनार, ये सर का दिन क्रम है। 700 से ज्यादा सेमिनार उनके यूट्यूब पे अपलोड हो चुके हैं। सर HMI के 5 जनरल सेक्रेटरी भी रह चुके हैं। और सर CCH के एजुकेशन कमेटी के चेयरमैन थे, एग्जीक्यूटिव मेंबर थे। CCH में उन्होंने 3 टर्म में काम किया है। तो ऐसे हमारे आज के स्पीकर और हमारा मेन टॉपिक जो होम्योपैथी में सबसे हार्ट होता है, ऐसा जो टॉपिक है वो मायाजम। और मायाजम समझना बहुत हार्ड रहता है बच्चों के लिए। और सर आज उसी टॉपिक पे डिसीज के लिए अप्लाई कैसा करना है ये सब सर एकदम डिटेल में बताने वाले हैं। तो मैं सर और आपके बीच में नहीं रहते हुए सर के परिवार, मैं आप सबके बेटे बेटी है तो हम होम्योपैथ नहीं करना चाहते बच्चों को। मगर सर की एक विशेषता है कि उनका बेटा और बहू दोनों भी होम्योपैथ है, वो भी प्रोफेसर है गवर्नमेंट कॉलेज में। और सर वो भी अच्छे से सर के यह और रेपर्टरी के सेमिनार रूब्रिक के बारे में तो सर का एकदम हथकंडा है। और रूब्रिक इतने अच्छे से पढ़ाते हैं सर, तो सर को सुनने का बार बार दिल हमारा होता है। और सर ने मुझे जो कमिटमेंट दिया, मैडम कभी भी वेबिनार लो मैं हाजिर हूँ। इसके लिए मैं गुरु मिश्री होम्योपैथी मेडिकल कॉलेज, ओम शांति बहुउद्देशीय शिक्षण संस्था और हमारे इस पे जो डिग्निटरी जुड़े हैं सबके वजह से मैं सबके लिए मैं आपको धन्यवाद देती हूँ सर। और आप और बच्चों के बीच में ज्यादा देर न रहते हुए सर मैं आपसे रिक्वेस्ट करूंगी कि आप अपना सेमिनार वेबिनार चालू करें सर, आपका टॉपिक चालू करें।
हाँ, थैंक यू डॉक्टर कंचन जी। बहुत दिन से आपसे, मैं तो आपके कॉलेज में भी गया हूँ। और मुझे आप लोगों का और हमको आपको देख करके हमेशा हम लोगों को डॉक्टर देसाडर साहब का याद आता है। काफी अच्छे हमारे, इतने अच्छे मित्र रहे हैं शुरू से। और मैं आज उनके प्रति अपनी श्रद्धांजलि भी अर्पित करते हुए आज का मैं यह सेशन मैं आप लोगों के साथ में साझा करूंगा। So, good morning, friends, and I thank you that Madam has given me the permission to start this session. And in the background, you see my photographs and the live, the present photographs. Can you compare both the things? This is the miasmatic evolution of my life. Miasma usually we take it in a negative positions, but miasma has got both the positive and the negative. And this is the wonderful contribution by Dr. Hahnemann, who has introduced the miasma into our system of the medicines. No other medical science have ever considered this miasma or any the causation of the disease. Everyone looking for the materialistic causes, भौतिक चीज को, ये बैक्टीरिया है, वायरस है, इसके विषय में सब लोग सोचते रहे। लेकिन डॉक्टर हैनीमैन ने कहा कि देयर आर समथिंग सटल, इतना सूक्ष्म है, उतना सूक्ष्म है कि आप देख नहीं सकते। तो ये एक बहुत ही महत्वपूर्ण कंट्रीब्यूशन है डॉक्टर हैनीमैन का। आज मैं उसी को मैं कहता हूं कि ये चिकित्सा जगत में ये क्रांति है, रिवॉल्यूशन है। इसीलिए मैंने कहा आज का ये टॉपिक मैंने आपके साथ में शेयर करना चाहूंगा। साथियों, मैं अपना पीपीटी अपलोड कर रहा हूं। So, the miasma, a revolutionized view on the concept of the disease. Abhi just I have told you that no other medical system has thought about something dynamic type of the mind. And you may be aware that Dr. Hippocrates, who is the founder and father of the, who is considered as father of the medicines, he had already talked about this miasm. But even after it was not being implemented by the medical professions. It was the Dr. Hahnemann's insight that he looked into it. Yeah, there is some certain causations, some things are there behind every disease. It is not only the bacteria, because bacteria, they comes later on. It is not the virus, it is because they come later on. There are something prior to the bacteria, there are something prior to the viruses, there are something prior to the environmental changes. Something should be there, and that is very important understanding that we all have to think of. Okay, so let me start my PPT right now. We need a revolution now for any success in the system of the medicines, and medicines is never a static site. एकदम रुका हुआ चीज नहीं है, रोज बदलते हो, रोज बदलते हो, रोज बदलते हो. So we need a revolution, and every change is a revolution. And you just think that what we were studying our materia medica in our time, anatomy in our time, and in the present time, I see lot of the differences, lot of the enlargement are there. So when we need a revolution in the research and practice of medicines, and we need it yesterday, and we need it today, and we will be needing it every day. So be ready to revolutionize and start your journey of the life in your homeopathic system of the medicine. Yes, I say that it is a journey. It is the journey of your life that you have entered into the arena of the homeopathy. आप होम्योपैथी में आए, कॉलेज में एडमिशन लिए, होम्योपैथी प्रैक्टिस कर रहे हो, ये आपकी जीवन की यात्रा का पड़ाव है. यह पड़ाव में आपको निरंतर एक खोज करते रहना है. You have to keep on finding out the new phenomena. You have to, because every day you study the repertory, every day you study the materia medica, every day you study any of the system things, you will find something new. I have read several times about the aconite medicines, but each time I read, I find something. So this is the research aptitude that has to be there and that you revolutionize yourself in your life. Now, in this presentations, I am going to give you the abstract introductions, historical evolution of miasmatic theory, then classical miasma details, and then comparative table of the classical miasma, then psychological behavioral dimensions, then modern scientific correlations. It is very also important that whenever you study anything, you have to relate it and you have to prove before the science that the homeopathy is. And so scientific revolution correlation is important. Then I will give you some of the case studies. Then there is another important thing that I would like to talk with you, the dynamic miasma matrix, that is called DMM, and research implications, then public health and preventive perspective, then conclusion and the reference. So these are the topics that I am going to discuss with you today. Friends, as I told you that miasma was introduced into the system of the medicines. I don't say the medicines, but the system of the medicine. Because in the medicines, it was already introduced by Dr. Hippocrates. Earlier, long back, from 420 BC, it was he talked that there are something miasma, there are something pollution that makes you sick. आप बीमार हो जाते हो, कुछ बीमार करने वाला कारण है. But he couldn't explain it properly. And later on, nobody thought about that. And now Dr. Hahnemann was the first person that he introduced this miasma and formalized it into a system of the medicines. So understanding chronic disease and the constitutional predispositions. This is very important. Unless you are ready to accept the disease, no disease can enter into your life. जब तक आप पहले से, yes, any problem? Nobody can enter into your life. So there must be the acceptance. Disease enters by enters into your life by either defeating you or fighting with you or with your permissions. These are the way the disease enter your body. If you are weak, if you are your vital principle is not okay, then it is very much essential that the disease will overpower you. But if you are strong enough and if you are able to fight it, you will no disease can enter into your life. Even during the corona, many people, even working with the hospitals, even working in the other phenomena, they never became sick. Why? Because they fought it mentally, emotionally, and psychologically. So there is always a miasma of misinformations. This is from the higher education section. Now, what is happening today? Today, the things people are higher educations that we call the advanced scientific technology, the modern medicines. In the name of the modern medicines, they are not accepting this idea, the idea of the Hahnemann. And this is a challenging part for our homeopathy. Challenging part for homeopathy. So don't get confused by their advices. My advice always will be to ignore the perceived wisdom and look for the most reliable evidence on the ground. What is the reality that is present before you? This is the reality, and that has to be that we are talking today. This is the reality. We are here all together. This is the reality, and we have to accept it. Now, the history of medicines demonstrates an ongoing quest for understanding the origin, perpetuations, and management of the chronic disease. Everywhere, every area, right from the prehistoric area, when the persons were, we were not civilized. उस समय भी हम लोग खोज रहे थे, जब हम आदिम युग में रहे थे, उस समय भी हम बीमार पड़ते थे, और उस समय भी हम लोग चाहते थे कि हम लोग ठीक हो जाएं, और उस ठीक होने के क्रम में हम लोगों ने खोज किया और एक खोज करते चले गए, रिसर्च करते चले गए. Everything that you knew and right from your childhood you had been researching in your life, then why not you can make a research in the medicines? So Dr. Hahnemann, the founder of homeopathy, introduced the concept of miasma to explain the underlying predispositions that lead to the chronic disease. Now, the miasma is postulated as deep-seated, hereditary, or acquired tendency that influences susceptibility, severity, and recurrence of the disease. So, I was just talking to you that it is the deep-seated tendency, and this tendency may be hereditary, or you might have acquired during your own journey of the life, and they influence your susceptibility. On that tendency, you can become susceptible, and you can have the severity or the mildness of the disease or the recurrence nature of the disease. Sometimes people, like in the early childhood, you got a cold attack, and at that time you were able to have the more immunity power, and you fought it out, and there was no problem later. But if your hereditary disposition was not okay, then you were not able to fight it properly, and with that, what happened? You became lifelong sufferer of the lungs disease, any type of the disease. So this is the things. So the classical framework identified the miasma. Now, why miasma? Miasma is just a pollution, making you something negative. What we are learning today is educative. That you want to, it is a positive acceptance. And there are something which we accept it indirectly, and they are not positive to your life. So anything which happens opposite to your life and they pollute you, वो आपको प्रदूषित कर देता है, आपके माइंड को प्रदूषित कर देता है. You will become a sick. I would like to share with you a story of a child who was very innocent in his early life, and he was when he grew up, his father took him to the, he wanted to admit him into the school. He was very much excited. Now, while going to the school, he saw so many roads and shops and market and several people. And on the shops, दुकानों पर उन्होंने मिठाइयों का दुकान देखा, उसे बड़ा अच्छा लगा. अपने पापा से पूछा, वो इसमें ये मिठाई मुझे अच्छा लग रहा है, मैं खाना चाहता हूँ. तो पापा ने कहा, नो नो, आप अभी नहीं, हम लोग लौटते समय में देखते हैं. अच्छा ठीक है. He accepted. And while returning the home, the papa didn't, he forgot and he didn't do it. The next day also he tried, next day also he tried, but his father was not listening. So what happened? Now he started thinking, my papa is not listening me. Why I should not try myself? So he tried to steal the money. चोरी करना कोशिश किया अपने पापा के पॉकेट से. Small amount he took. Nobody knew that it happened. And gradually he develops a habit of kleptomania. चोरी करने की आदत लग गई. अब ये क्या विकार आया? Because the people had some negative thoughts started. Whenever anything enters into your life, both positive and negative, he wanted, if his father would have given him something positive, then this thing might not happen. But the situation was that his father was not able to understand the child psychology, and he refused. And this way, this is the acquired predispositions factor. And this, so I was just trying to explain you this way. So now this, when it comes at this stage, this miasma, it has when miasma enters into your life, then it start growing, developing, है ना. एक से बाद दूसरा तीसरा वो अपना लेयर बनाते जाता है, माने लैड सीढ़ी के जैसा. तो सबसे पहला सीढ़ी होता है, उसको हम लोग सोरा कहते हैं, यानी कि इच. That the itch that happens in your mind to do or not do, to do or not do. This is itch, and this is the process while having a physical itching, what do? We just move our hand like this. So yeah, this is to and fro motions of the mind that work on thinking pattern. Thinking pattern is very important. And this enters. So this when it is in the earlier stage, it is soric. And then it becomes a planning stage, that is called psychosis, and then it becomes established stage. So the sora is the entrance, psychosis is the management, and syphilis is the results. This is the subsequent, and then comes the next type of the miasma, which has been earlier. Dr. Hahnemann has identified only 3 miasma, but later on, many of our stalwarts have added tubercular miasma, cancer miasma, like this. Now, despite criticism from the allopathic medicine, it is metaphysically a non-measurable nature. Now, what is the type of the miasma? It is a non-measurable, that you cannot measure. And Dr. Hahnemann type of the measurement was measuring into the 3 groups, soric group, psychotic group, and so, but this is not a measurable. There is no demarcations like इतना होगा तो सोरा होगा, इतना होगा तो साइकोसिस होगा, इतना होगा तो सिफिलिस होगा, ऐसा नहीं है. तो लेकिन हम लोग खाली एक ब्रॉडर व्यू में करते हैं, इसीलिए साइंटिफिक वर्ल्ड जो है सो इसे काफी हम लोगों को क्रिटिसाइज करते हैं, है ना. तो इसमें क्लिनिकल यूटिलिटी और ये चीज है. But this is helpful. This is helpful for you when you understand the miasma properly. It will help you to guide in your case taking. किस पेशेंट से कैसे बात करें. It helps you to guide the remedy selections and the long-term management. Managing a soric patient, managing a psychotic patient, managing a syphilitic patient, you have to require the management process. Today, as chronic disease is dominating global health burden. Now, what we see that chronic disease nowadays. We are suffering more than the acute disease. There are less pandemic, more lifestyle disorders. There are less acute disease, they are more chronic disease. And the multiplied chronic disease, or that is also known as the heterogenic, medicinal miasmatic or mixed miasm. Dr. Hahnemann has called it the mixed miasm, the chronic miasm. So now let us go further. Dr. Samuel Hahnemann first introduced this concept, as I told you, in 1828, and he described it as the root cause of the chronic element arise from the suppressed erection. Now, just there is a confusion about the whether only the patient who is having the skin disease, they will get the psora or not. Because Dr. Hahnemann discovered this miasma after reading and making a research over the thousands of his patients' history, where he found and observed the each skin conditions. They found it. He talked about the itching, but itch is about something else, according to the Dr. Hahnemann. Itch is that is the to and fro motions, the thought process that is going on in your life, the wave-like motions that happens into your life. आपके माइंड में जैसा चल रहा है ना, आगे पीछे, हाँ करे नहीं करे, आप परीक्षा में चोरी करें नहीं करें, these type of the things you used to do, plan for. And if you say no, I will not do the chori, then what happens? Do you become you are not sick? But when you do the chori, when you copy something from the you have some doubts in your mind. Someone might caught me. Some fear comes, and this is the causations for the revolution and getting the subsequent illness. Later, homeopathy, Dr. Kent, Constantine Herring, and Clark also explained this in a very refined idea. And still today, not only Dr. Hahnemann, Dr. Kent, still people today, there are many more literature that you will find on the about the miasma. Have you heard about the Ortega miasma? Ortega, wonderful book is there, and it is of this present era. Kent emphasized on the mental and emotional aspects of the miasma. See what Dr. Hahnemann talked about, the skin itches. Now he say this is the refinement of the miasma view of the master Hahnemann by Dr. Kent. Skin itches, that is on the physical plane. He say no, each on the emotional plane. है ना, कहते हैं कि इधर ये पहले आपका शरीर पे नहीं आता, पहले माइंड में आता है और फिर तब आपका शरीर में जाता है. ये डॉक्टर केंट का इम्फेसिस है ना. तो इसे बिहेवियरल टेंडेंसी एंड टेम्परामेंट पैटर्न कहते हैं. हेरिंगसन also documented some clinical observations linking miasma as a chronic disease, skin eruptions, and hereditary pattern. So these are the area that has been ongoing on. In the 20th century, now see the 20th century, the new miasma were introduced. It is not the syphilis. Now they are coming up with the tubercular, cancer, or many more. Not even the people say the AIDS miasma. This is also the way that people have started talking. So it is emerging with public health challenges, including tuberculosis, cancer, and metabolic syndromes. Historical criticism, primarily from allopathic physicians, argued miasma lacked empirical evidence. Allopathy people say that there is a lack of empirical evidence. इसका कोई proof नहीं है. लेकिन we homeopaths have a strong and firm belief that are the clinical relevance. They are something which is clinical relevance cannot be found in the books, cannot be documented, because there are many things on this planet that can never be documented. बहुत सा चीज है जिसका कि आप डॉक्यूमेंट कर सकते हो, है ना। जैसे आप लिखते हो कि मुझे गुस्सा आता है, तो गुस्सा का आप डॉक्यूमेंट हुआ, लेकिन गुस्सा का मेजरमेंट आप कैसे करोगे? उसको कोई नंबर में तो नहीं बताओगे कि 1 डिग्री का है, 2 डिग्री का है, 4 डिग्री का, ऐसा डॉक्यूमेंटेशन नहीं हो पाता। And this is the reason why they want everything to be documented. And there are emotions cannot be documented, mind cannot be documented. But there are some people who are working on this documentation process, and they are working in the psychology. And this is very, but yet they also feel that here is a limitation. So modern homeopaths, we have making new concepts, new idea, and now we are adding on the hereditary, environmental, emotional pattern, and lifestyle factors. Now, let us come to the miasma. One by I will give you a short descriptions about each of the miasma. The soric characteristics is there. Soric is the physical characteristic. They are hypersensitivity, chronic inflammation, skin eruptions, eczema, asthma, digestive disorders, and fatigue. Okay. Then mental and emotional perfectionism. Everything should be right. It should not move and here and there. Perfectionist. Everything should be perfect. Insecurity, excessive vigilance, and a highly observant type of the persons, and anxiety, obsessive compulsive tendency. And the modern correlations, what is there? Now, this I am comparing it with the classical miasma with the modern correlation is chronic low-grade inflammations, allergy, autoimmune predispositions, and heightened stress response. They comes under the purview of the psora. Psychosis, it is the physical plane. It is proliferations or obstructive tendencies such as warts, polyps, fibroid tissue, and chronic inflammations. Emotional and mental traits are secretive, possessive, है ना, इकट्ठा धन को इकट्ठा करना, पकड़ के रखना, rigidity, obsessive, and controlling behavior. And now the modern correlation is fibrotic disease, metabolic syndrome, and with insulin resistance and persistent infections. And similarly, syphilis, it is physical, it is destructive, degenerative tendency, tissue erosion, congenital deformity, ulcer, autoimmune manifestations, and mental despair, nihilism, destructive impulse, self-sabotaging, suicidal, and many things more. Then modern correlations is the autoimmune disease, neurodegenerations, accelerated tissue disease. Have you heard about the myopathy? Have you heard about the atrophy? And all these things are the degenerative process. Then tubercular miasma is physical. It is instability. It is always restless, susceptible, chronic respiratory conditions, bone and pathology. Mental, novelty seeking. They want everything perfect, emotionally volatile. They are rapid burnout, fear, and confinement. Modern correlations are there. Chronic infections, respiratory compromise, metabolic imbalance, and fatigue syndromes. Cancer, it is over-proliferation, suppressed emotions, malignancy tendency, and pre-malignant lesions. Then mental and emotional, rigidity, perfectionism, suppressed grief, fear, and vulnerability. Modern correlations are there. Stress-related dysfunctions, pre-malignant, malignant lesions, and somatic rigidity. Now, so this is the comparative chart. Psora, skin eruptions, eczema, allergy, mental, anxiety, perfectionist, vigilance, and modern chronic inflammations and allergy. Psychosis, warts, fibrotic tissue, polyps, secretive, obsessive mental pattern, and fibrosis metabolic. Syphilis, tissue degenerations, ulcer, then despair destructive and autoimmune neurosis. Tubercular, recurrent infections, respiratory tissue, restless, emotional volatile, and chronic infections. Cancer, malignant growth, overproliferation, perfectionism, suppressed emotions, stress-related dysfunctions, and pre-malignant. So this is a comparative chart, and independently also I have told you. Now, miasma, they don't influence only your physical, but also your mental and physical behavior. So miasma, you don't feel that it is only a mental. This is the psychological and behavioral dimensions I am talking about. So psoric tendency, they are anxious, meticulous, very particular, socially cautious, leading to the functional disorder in persons and professional life. Psychotic, obsessive, secretive, controlling, contributing to the metabolic or proliferative pathology. Syphilitic, destructive, mental exaggerations and degenerative. And then tubercular and cancer, restless, perfections, suppressed emotions, and fueling chronic disease. So clinical importance that when you integrate the psychological assessment with the miasmatic evolution, it allows you to target both the somatic and the mental manifest. क्या होता है जब आप साइकोलॉजी को पढ़ लोगे, इसके साइकोलॉजी को समझ जाओगे, तो आपको इसका साइकोलॉजी मेंटल और फिजिकल दोनों को ठीक कर सकते हैं. अब नाउ व्हाट आई कैन इन 2 or 3 words I tell you, the psora is on the surface. Psychotic, it is this disturbance in your functioning system. Syphilitic, it is destroying your tissue. So it is on the surface, and psychosis is on the middle side and the later on. Now, I also give you example. When a seed start developing, what happens? It's slightly, there is slight changes are there on the earth, and then but people don't recognize it. So psoric tendency, it is usually not. Suppose you are going to become sick, and before the sick, you have to think that like this, अरे कुछ हो रहा है, कुछ अच्छा नहीं लग रहा है. But when you go to the doctor, no, you don't have the problem, because he's not aware that something is going to happen. Then when the things come up and started working, then it is psychotic. And when it is now destroying your life, it is syphilitic. And then when you are with the distractions, you become restless and degenerations, that becomes the tubercular or the cancer. So it is just the area that helps you in understanding the life cycle. Now, whenever you take a case, suppose you are taking a patient of the headache. Now, headache, before you have to ask the 3 questions. First is, what happens before the pain starts? What type of the sensation, that is also known as the aura. It is not only the epileptic aura. Aura is present in every symptoms that start entering into your life. So, and with that tendency, and this state is the psoric tendency. And then when you during the conditions, headache, what is you are feeling? It is bursting type, it is burning type, it is cutting type. This is the psychotic tendency. And syphilitic tendency, now with this, I'm trying, I don't want to live, I want to die with this pain. And this is the syphilitic tendency. And with this, you become so much restless. Now you are moving toward another journey. So modern scientific correlations are there. Epigenetic, environmental exposures and early life experience modify our gene expressions. When we are living not in a very fully proof environment. Environment is ever changing and unprecedented. कब क्या होगा ये जानना बड़ा मुश्किल होता है. अभी तुरंत बारिश हो रहा है, तुरंत धूप होने लगेगा. So it modifies your experience, and then it aligned with the idea inherited disposition. Then microbiome, gut, skin. There are the micro. They are watching you. They are watching you to enter into your life. So they enter into your life whenever you become sick. And then psychoneuroimmunology, stress then starts the psychic pattern, and your emotional stress regulations become influenced. Then environmental medicines, pollutant are there, many pollutants are there, chemical exposures are there, and antibiotics, lifestyle factors are the contemporary miasmatic fears. Now I'm going to discuss one case. I'm going to discuss one case each of the each miasma. This is a patient, 30 years old female. She approached for her eczema with discharges, itching and burning, and was very anxious constantly about it. Her digestive issue was also associated with the slow digestion. Now this lady, she was suffering from the eczema, and this eczema was very itching type and discharging type. Some type of the liquid was coming out from the skin. It was burning in nature, and at the mental plane, she was very anxious about it. Her digestive issue was also not associated. So with that, she was constantly brooding over the problem. Kyun ho gaya? Kaise ho gaya? She was always thinking about a thoughtful manner. She was soft-spoken, mild lady, but confident of getting. उसको लगता है कि नहीं ठीक तो हो जाएगा. बहुत शांत लेडी थी. Whenever she was free, she used to plan for the day. है ना? So जब भी खाली रहते थे कुछ कुछ सोचने लगता थी कि सपना देख रही है, कुछ प्लानिंग कर रही है. In the past life, in early childhood, she had suffered from the scabies, which was treated by the allopathic medicines, and there were no other significant physical. In her family, parents were retired and no basic problem, but we are taking the आजकल का तो जितना ये old age है, वो hypertension और diabetic medicines ले रहे हैं. So his parents are diabetic and hypertension. She was a 3 brothers, 2 sisters, and they are also having the skin problem. She was married at the age of 21. Her husband was employed in the government department. She delivered 1 male child. All were okay. Now she was soft-spoken, as I told you, and we saw her to be very thoughtful during the case-taking process. She was confident of getting success in the life, and every detail she answered very properly. This is the very meticulous type of the lady. Then occasionally she was getting headache during the sun and the fasting. After fasting, उसको धूप में जाने से, सन में जाने से सर में दर्द होता था. खाली पेट कोई फेस्टिवल में जब उपवास करना होता था तो उसको सर में दर्द हो जाता. स्टूल वाज वॉकिंग, लेकिन उसे सवेरे अर्ली मॉर्निंग में ज्यादा पड़ता. तो डाइजेशन वाज स्लो. शी वाज टेकिंग बाथ इन द मॉर्निंग, और उसके बाद पूजा करना. इन द फ्री टाइम शी लव्ड रीडिंग बुक्स. खाली समय में पढ़ना चाहती थी. शी लाइक्ड विंटर वेदर बट डिसलाइक कवरिंग हरसेल्फ ड्यूरिंग द नाइट. Now I took the following rubrics: skin eruptions, eczema discharging, skin eruptions suppressed, cold tendency taking, thoughtful, she was a thoughtful lady, mildness, itching, confident, and theorizing. Now you see this 8 rubrics I took. There are physical rubrics, the mixture of the totality. Totality must have the mixture where the physical, mental, and general symptoms should be there. So this is the mixture of the 8 symptoms, the physical. And now with this, we repertorize the medicines. You see the first medicines covering the all the rubrics, followed by the second medicines. So definitely you all might agree with me that it is a case of clear picture of the sulfur. You know that I don't give the medicines through the mouth of the patient. I transmit it through the hair of the patient. So I transmitted in 0/3 potency and asked her to come after the 15 days. She came back with the better mental feelings and digestions was better with better stool. उसका स्किन में कोई चेंज नहीं हुआ था. No change in the medicines was done and then again asked to come after the 15 days. अभी फिर आई. उसके बाद में अभी डाइजेशन अच्छा था, मेंटल फीलिंग्स अच्छा था, स्टूल अच्छा था और ये इस समय में इसका डिस्चार्जेज और इचिंग जो है तो और बढ़ गया. So, but we didn't because now it is just following the law of the cure. So, because mental relief are there, physical aggravations, those is a good sign that we. Then she came back with better mental feeling and digestions and was better with better stool. This time the discharges and eating up धीरे धीरे वो घटना शुरू हो गया. No change in the medicines was done and asked to report after the 1 month. She came back with the mental, everything was okay. Now the eruptions become faded away, but सब खत्म हो गया था लेकिन ईच हो रहा था. कोई दवाई हम लोगों ने नहीं बदला. She came back with better mental feeling and digestion was better with better stool. का eruptions भी खत्म हो गया था, itching भी कुछ scales निकल रहे थे और फिर वो कोई चेंज नहीं किया गया. फिर आपको फिर 1 महीना के बाद में फिर आई. अभी तक सारा केस खत्म हो गया था और करीब करीब हम लोगों ने 1 साल तक भी फॉलोड द केस विथ नो रिलैप्स एंड द ट्रीटमेंट वाज स्टॉप as the patient didn't start coming. So this is the first case which is of the psora. Now second case I am going to discuss about the psychosis. एक 25 साल का महिला पर्सन था. इसको हाथ में वॉट्स और कुछ फाइब्रेटिक लेशंस था बॉडी के डिफरेंट पार्ट में. उसे कुछ तकलीफ नहीं था बट ही वाज कंसर्न्ड अबाउट फ्यूचर कोर्स. उसे लग रहा था कि फ्यूचर में क्या होगा एंड वाज एंग्शियस कॉन्स्टेंटली अबाउट इट. हिज डाइजेशन इशू वाज आल्सो वेरी एसोसिएटेड. हिज डाइजेशन वाज स्लो. जल्दी खाना पचता नहीं था एंड he was a commanding and attitude. अपनी बात को हमको हमेशा प्रूव बोलना चाह रहा था, है ना. Consultations he was frequently trying to accept his view with commanding attitude. He was dominating the family as he was told by the attendants. बहुत dominating nature का था. Brooding over the problems and thoughtful manner. His speech was harsh, बहुत harsh speech था. Shows much confidence in himself. अपने को बहुत confident समझ रहा था. Whenever she was free, she used to listen music with some favorite hobby, and she loved music. और कभी-कभी वो गाना भी गाता था. He was fearful of blowing winds and used to keep. हवा का झोंका से उसको तकलीफ होता था. पंखा को फैन को लो वॉल्यूम में चलाता था और इसका जिससे कि he was constantly trying to eat something. One of the symptoms that I noted that he was constantly eating something. In the clinic also, he took out something from the pocket and put it into the mouth. I asked what it is. I said it is nothing. It is cashew nut. वो किस ये है काजू है. So I said why you are eating now? I said just एक अच्छा लगा इसलिए खा. This is the habits and I will talk to you with the while I discuss with the rubrics. Now, dictatorial nature, you must be sensitive to the music, fear of the wind, then cold air aggravate, a live sensation in abdomen, something is there. Dream of falling from the height was there. And bulimia, something eating, kuch idhar kha lo, kuch ye kha lo, kuch ye kha lo, and face was greasy. And you may be just thinking that the medicine is right, it is puja. And phosphorus, both are equal numbers are there, puja and phosphorus. So puja was prescribed in 0/3 potency. Why I didn't selected the phosphorus? Because of the dictatorial nature, which is more dominating in thuja and less dominating in the phosphorus. So because thuja are always hard type of the thing and phosphorus are the soft type of the personality. But both are dictatorial also, same time. Then after 15 days, he came back with the better mental feelings and digestions was better. There was no significant change in the wards. And again, we asked him to come after 15 days. He came back with better mental feeling and digestions was better with better stool. इसे लगा कि इस बार कुछ wards जो है, so they are drying up. No change in the medicines was done. Again, he came after 15 days, and now the digestions and appetite were normal. And this time, some of the warts had fallen out, गिर गया था, and fibroid lesions कुछ छोटा हो गया था. अब मेडिसिन नहीं दिया गया, फिर 1 महीने के बाद में आया, and came back with a better mental feeling and digestions was better with a better stool. सभी वाट्स गिर गए थे और जो फाइब्रॉइड लेशन था वो बहुत ही सॉफ्ट हो गया था. कोई चेंज नहीं किया गया मेडिसिन को. पेशेंट फिर 1 महीने के बाद में आया. ही केम बैक विथ बेटर मेंटल फीलिंग्स एंड डाइजेशन बेटर, सभी ठीक रहा. वो अब तो कोई वाट्स था ही नहीं और फाइब्रॉइड लेशन भी इतना सॉफ्ट हो गया था कि नजर नहीं आ रहा था. एंड देन ही केम बैक अगेन आफ्टर 1 month. इस समय भी सारा कुछ ठीक था. अब उसके जो फाइब्रॉइड लेशंस थे एकदम ही लग रहा था कि खत्म हो गया है. तो फिर 1 महीना के बाद में आया. केस को हम लोगों ने 1 साल तक फॉलो अप किया एंड देन द ट्रीटमेंट वाज स्टॉप बिकॉज. So this is about the psychosis. Now I am coming to the syphilis presentation. It is a case of 50 years old male. He has a nodular growth on the scrotum, है ना. जेनाइटल्स में स्क्रोटम के ऊपर में कुछ नोडुलर ग्रोथ था जो कि हार्ड था और ब्राउन कलर का था. He has a ulcerative skin भी था जो which was very smelling type and syphilitic type. He was a government official at the वो गवर्नमेंट ऑफिसर बहुत हाई पोजीशन में था and used to get plenty of, उसे ब्राइब के रूप में बहुत सारा पैसा मिलता था. And he was taking the wine and the alcohols. It was his habit. His only desire उसका था कि मुझे जीवन में खुशी चाहिए और he has a relationship with the several ladies. He was very suspicious and used to check everything twice before leaving the place. ऐसे लोग होते ही हैं suspicious, है ना. जो जितने ज्यादा गलत करेंगे उतना ज्यादा उनको डर बना रहता है. So they are suspicious. And his teeth has started decaying with carie, and now it was becoming irritable and repentance about his deed. अब लग रहा था कि मैंने गलत किया अभी लाइफ में और उसका लेकिन फिर भी confidence था. So in the past he had suffered from scabies in the childhood, था treated allopathically और कुछ नहीं था. फैमिली में भी कोई बेसिक प्रॉब्लम नहीं था, केवल हाइपरटेंशन और डायबिटिक मेडिसिन उनके पेरेंट्स ले रहे थे. उसके सारे ब्रदर्स के थे वो नॉर्मल थे, वो लोग इस तरह के नहीं थे. He was having sexual relationship with the girls before the marriage and also after the marriage. He was a cold patient and used to avoid taking bath. His sweat were foul and offensive. I think I will be talking to you, discuss, raising hand is not okay. At the end, you can ask any of the questions. He was a cold patient and used to avoid taking bath. Now, this is the rubrics that I selected: confidence, want of self, checking twice, washing hand is always, alcoholism, history, personal tonsillitis of recurrent, skin ulcer, syphilitic, male genitalia, nodular scrotum, brown, hard, and teeth were crazy. So now this is the combinations, and I got the syphilinum. See, all the 8 symptoms is covering. This is the beauty of repertorizations. When you mix up together, they should come on the top. And the silicea was also there. Now, there was no question that I should think about the silicea because the mentality of the syphilinum was quite okay. So we put the medicines in 0/3 potency. We asked to report after the 15 days. And we also asked him to अपना आदत को ठीक ठाक करो नहीं तो अपना जिंदगी तुमको खराब रहेगा, ऐसा मैंने उनको बताया। He came back with the mental better feeling, but there was no change in the physical conditions. No change of the medicines was done. Again 15 days he came with the mental feeling अच्छा ही था। नॉडुलर ग्रोथ जो है सो सूख गया था, और स्किन का जो अल्सर था वो और ज्यादा बढ़ गया। नो चेंज इन द मेडिसिन वाज डन, आस्क्ड टू रिपोर्ट अगेन आफ्टर 15 days. He came back uh, he came back better mental feelings are reported. I will be talking you, Dr. Nirmal, later on. Let me finish this. He came back with better mental feelings. He reported that now the nodular growth are almost finished. Okay, and skin ulcer was also healing process. No change in the medicines was done. So now, now he all the were finished. Skin healing was only scar was left, and medicines no change in the medicine. Then again he came back. Everything was fine. No scars were there. Ulcerations was not there. His washing habit mania was still there, but now try to अभी वो सोचता था नहीं नहीं मुझे ऐसा नहीं करना चाहिए, ये थॉट्स आने लगे थे। और now again he came after 1 month. This time nothing was there, and mentally he was feeling better. We followed this case for the 2 years, more than 2 years, and there was no relapse in the problem, but his habit was not changed ultimately. Now there is a tubercular case. Now I am going to discuss you the fourth miasma, that is tubercular. It is a 12-year-old male child. इसके पेरेंट्स उसको लेकर के आए मेरे पास में. He was suffering from bronchitis after he has a tonsillitis in the childhood. बचपन में उसको टॉन्सिल था. He was lively child and mixed up with affectivity. He wanted to make friends and travel abroad to see the world around. Yet he was fear of the dog and hates the animal. He used to take cold tendency frequently. And during bronchial attack, he used to become breathless and felt congestion in the chest and the head. In head, feeling of a band sensation was there. उसके बचपन में उसको स्केबीज भी हुआ था, and he suffered from treated with the allopathic medicines and no other treatment was skin problem. फैमिली हिस्ट्री में कोई प्रॉब्लम नहीं था. वो हाइपरटेंशन और इस का दवाई ले रहे थे खाली. His father had suffered from the tuberculosis of the lungs earlier, और बाकी लोग सब कोई ठीक थे. He was a student, wanted to earn money. पैसा चाहिए. पैसा क्यों? बाहर घूमना है, ट्रैवल जहाँ करना है, और वो ड्रीमी चाइल्ड लग रहा था. Occasionally he was getting headache after fasting. His stool was okay, digestion was moderate. He liked taking bath in morning. In free time, he used to play with the children. Now the rubric is family history of tuberculosis. I have reported all the cases from the radar opus. His tuberculosis, traveling desires, cold tendency, fear of dog, allergic constitutions, inflammation, bronchial tubes chronic, head congestion, heart constriction, band or loop-like, and personal history of tonsillitis. The medicine is tuberculinum. Next medicine is mercurius and sulfur. So tuberculinum was prescribed in 0/3 potency. The patient came back, mental feeling, respiration was better with cold, no significant in the allergic conditions. अभी तक नहीं हुआ था. 15 दिन के बाद में फिर आया. better mental feeling, chest congestion अभी अटैक नहीं हुआ था, and no change in the medicines was done. He came back with better mental feeling. Chest congestion अभी नहीं हो रहा था. There was no allergic sneezing when playing outside, and again he came back after 1 month. Then इस समय तक आपके एलर्जिक कंडीशंस सारे कुछ अच्छे थे. 1 महीने के बाद भी, फिर उसके बाद में फिर उन्होंने आया 1 महीने के बाद में. उसके बाद भी इनको सभी कुछ ठीक था. कोई दवाई हम लोगों ने नहीं बदला. He came back, और अगेन स्नीजिंग्स ऑफ द नेजल डिस्चार्ज नहीं था. मेडिसिन वाज, तो ये करीब करीब हम लोगों ने we treated them for the 1 year, and after that the treatment was stopped. Now the last case is the cancer. This is not a case of the cancer, but the miasm cancer. A 45 years old male approached to us for her warts, which were very small and several places in the body. As it was not giving any trouble, yet he was concerned about the future course and anxious constantly about it. He was very much particular about those things that he kept arranging them every time. सबको ठीक ठाक करके रखना है. Even in our clinic, he tried to arrange our table where some books were. हमारे टेबल पर भी कुछ किताब ऐसे ऐसे उधर रखे हुए थे, तो उसको वो ठीक करने लगी. Asking about his previous life, it was revealed that he was a very strict guardian and used to dominate with every activity. बहुत कड़ा दिमाग दिखा. He suffered silently, but acquired a fastidious nature of doing things carefully and perfect manner. He was very emotional and loved natural places. Even living in town, wherever he got opportunity, he used to visit outside town and sat watching the natural beauty. बचपन में उसको भी स्केबीज हुआ था. आजकल ये जनरली आप देखिएगा, फैमिली में बेसिक प्रॉब्लम नहीं था, उनके डायबिटिक और हाइपरटेंसिव मेडिसिन ले रहे थे. हिस्ट्री ऑफ कैंसर का फैमिली में था, फैमिली में कैंसर का हिस्ट्री था. ही वाज 2 ब्रदर एंड सिंगल, दे वर आल्सो नॉर्मल लाइफ. 20 साल की उम्र में शादी हो चुकी थी, उसकी वाइफ हाउस वाइफ. He had started a career with the business of marketing fabrics and garments, and had a small shop in the town. And occasionally he was getting headache after fasting. His stool was okay, digestion was moderate. He liked taking bath in the morning, and in tea time he visit natural places. Now see the rubrics. Why I took fastidious? Because very particular. Then he loved nature. He was sympathetic. Element from domination. See, because his father was very dominating, and with this he developed the fastidious. And as an outlet of the mind, he wanted to have the natural places. And the outcome was the warts, which were small in nature, and the family background was the cancer, and the emotions was suppressed in the life. And the clear-cut picture of the carcinosin. Now see, carcinosin, usually what I have observed, that it is never indicated, seldom indicated, I'd say not never, but seldom indicated in the cancer cases, but more frequently indicated in other sickness also. And this is the beauty of the carcinosin. When you are utilizing the carcinosin medicine, you must be aware that there should be proper mental evaluations rather than the physical evaluation. So the carcinosin was the picture. Next medicines was the causticum. Definitely I put carcinosin in 0/3 potency. उसको अच्छा लगने लगा. After 15 days, वाट्स में कोई चेंज नहीं आया था. फिर 15 दिन के बाद में आया, वाट्स सूखने लगा. एंड देन फिर मेंटल डाइट सब कुछ ठीक था, और उसके वाट्स बहुत सारे गिर गए थे, और फिर बाद में वो आया. फिर इस समय में सारे वाट्स खत्म हो गए थे नेक्स्ट टाइम जाने के बाद में. फिर वो मेंटल फीलिंग, डाइजेशन सब कुछ अच्छा रहा, कोई भी वाट्स नहीं था, सब कुछ अच्छा हो गया था. एंड हम लोगों ने 1 साल तक इसको फॉलो किया, और कोई भी इसका रिलैप्स नहीं हुआ. तो इस तरह से हम लोगों ने 5 केसेस को देखा, और पांचों केस में आपने देखा कि मैंने फॉलो अप किया है और रिपर्टोरियल एनालिसिस किया. बिकॉज आई कैन नॉट prescribe a medicines on the from my mind. I cannot depend on my mind. I have to consult and consulting a repertory is better than consulting any other else for the medicine. Now I am coming to the dynamic miasma matrix. What it is? Dynamic miasma matrix. That means matrix means the structure. how it is there. So integrate. We have to integrate all them. Genetic predisposition, environment, epigenetic modifications, microbes compositions. There are two types of the microbes in your body. One are friendly, and they are living in your abdomen, in the gut system, and there are friendly and they are enemic also. Both. How much, what type of the combination is there? Then environmental exposition, साइकोलॉजिकल स्ट्रेसेस, आपका काम का है, बिजनेस का है, सारे चीज का, एंड क्लिनिकल. सो दिस इज कॉल्ड द डायनेमिक miasma matrix. And when you have to consider all these things, you can draw a conclusion about that, arrive at the things. So purpose is to enable measurable assessment of miasmatic tendency and पर्सनलाइज्ड रेमेडी सिलेक्शन. इससे क्या फायदा होगा? आप अपने उसके माइजमेटिक टेंडेंसी को आप इवैल्यूएट कर सकते हैं. हमको आगे के लिए क्या सोचना चाहिए? लॉन्गिट्यूडनल कोहॉर्ट स्टडी करना है. दिस इज द माय डायरेक्शन, माय सजेशंस फॉर यू टू थिंक अबाउट द लॉन्गिट्यूडनल कोहॉर्ट स्टडीज, बायोमार्कर एनालिसिस, माइक्रोबोम सीक्वेंसिंग, एआई असिस्टेड. आजकल एआई का जमाना है, आर्टिफिशियल इंटेलिजेंस, एंड इट इज वेरी मच यूजफुल, बट यू डोंट मेक इट योर डोमिनेट ओवर यू. यू मेक यूज इट एज ए टूल्स, नॉट एज ए person to guiding you, because many a time you will not find it correlating it. So use it very cautiously. Then randomized control करने का, ट्रीटमेंट का है, और DMM गाइडेंस का भी जरूरत है. पब्लिक हेल्थ अवेयरनेस, कंट्रीब्यूटिंग फैक्टर्स हम लोगों को, पब्लिक को बताना चाहिए. प्रिवेंटिव स्ट्रेटेजी बचाव के लिए, रिड्यूस अर्ली लाइफ adversity, minimize toxic exposure, optimize nutrition, and promote stressor resilience. And then potential for future population interventions, integrating miasmatic principle to reduce autoimmune, metabolic, and mental disorders. So at the end, we can say that it will remain a cornerstone of homeopathic philosophy, and it cannot be, homeopathy cannot be practiced, cannot be taught without the miasma. By integrating historical insight, clinical observations, psychological understanding, and modern scientific correlate, miasma can be reinterpreted in dynamic, measurable, and constant. The dynamic miasma matrix bridges traditional homeopathy with contemporary biomedical framework, enabled holistic evidence-informed approach to chronic. ये जो डायनेमिक DMM की बात मैं कर रहा हूँ, ये बहुत ही इंपॉर्टेंट, एसेंशियल है ट्रेडिशनल होम्योपैथी को बायोमार्कर, बायोमेडिकल फ्रेमवर्क और मिला करके एक होलिस्टिक एविडेंस बेस्ड इंफॉर्मेशन बनाने में आपको मदद करेगा. और उसके लिए आपको वो 5 जो बजट दिया आपको, उसको देना. एंड फ्यूचर रिसर्च विल स्ट्रेंथन माइजमेटिक थ्योरी ये दीज आर द रेफरेंसेस दैट आई हैव टेकन, Hahnemann's and ये thing. So at the end, I will, sooner or later your work speaks for itself. Outlasting critics feels like it will take a very long time, but you are more patient. तो आपको अगर जितना धैर्यपूर्ण काम करेंगे, धैर्यपूर्ण चुनेंगे, आपको बहुत अच्छा लगेगा. So with this, I conclude my session.
Hello?
And thank you all. And thank you all for this. So yeah, anyone want to say something? I'm now stopping my slides here now.
Thank you very much, Dr. Sahani sir. On behalf of Dr. Desada madam, all our UG interns and Ghmch Homeopathic Medical College family, I really appreciate the way, very simply and properly, in proper words, you have explained us the cases and the details about the miasm. definitely it will be fruitful and it will further add to our knowledge. I request Dr. Desada, madam, please you vote of thanks.
Dr. Javeria is here. Dr. Javeria, she is Associate Professor, Guru Misri Homeopathy Medical College, Organ and Department. Dr.
Yes,
Javeria, say something?
yes, ma'am. Yes, ma'am. I'm here.
Yes.
Anyone have any questions? I am
Any
ready
question?
to. One question was there
Stop.
on the chat box, and that question was related to the potency. Now, what in all the cases that I have described, I use the 50 millisimal scale. Are you aware of this potency? I think you must be aware about this potency because it is there in your syllabus. Now, Dr. Hahnemannian journey of the potency is very, we have to understand. Sometimes later on I can give you the detailed journey of the potency, but Hahnemann started with the without any scale. है ना, डॉक्टर हेनीमैन अपना प्रैक्टिस में शुरू में के समय में कोई भी स्केल यूज नहीं करते. He was used to taking a glass of water, some water. He used to pour the drop of the medicines, and then he will ask the patient to take 1 teaspoonful and take. Then he will throw all the water from the bottle, the glass, and then put fresh water to give the shaking, proper shaking, and this was it. So shaking is important, and reducing the quantity of the medicine is important. And this way, later on, to make it uniform, the decimal scale was discovered, centesimal scale came up, and at the last stage, Dr. Hahnemann in the 6th edition of the organ mentioned about the 50 millisimal. Why 50 millisimal scale? In almost every potency and every case taking, case process, we see the aggravations, homeopathic aggravations. We are concerned with the homeopathic medicine. After giving the medicines, if the potency is not similimum, quite similimum, क्या होगा? It aggravations होगा, थोड़ा सा होगा. और जब तक aggravations नहीं होगा तो cure नहीं होगा. तो ये aggravations कितना होना चाहिए? How much? Yeah, it was the wonderful questions that was in the mind of the Dr. Hahnemann. So he wanted that the aggravation should be as minimum as possible. People used to say that इसमें aggravation नहीं होता है LM potency में, मैं बोलता होता है. अब बिना अगर नहीं होगा तो homeopathic medicines action नहीं कहलाएगा. As minimum as possible. This is one of the beauty of the 50 millisimal potency. Then another beauty is that the selection of the potency. In centesimal scale, what you do? You use 6 potency, then you use 30 potency, 200, and then 1M. Why this long gap, jump? हाँ, 30 से उछल करके 200 और 200 से उछल करके 1000. Why this long gap? And there are several, but here it is a ladder like 1, 2, 3, 4, 5 ऐसे जाते. This is a uniform development of the potential. So this is the idea, new idea that is added on. Now about the higher potency, low potency, there is a clear-cut guidance in your organ of medicines. Higher the sensitivity, higher the potency. जितना ज़्यादा sensitivity होगा, उतना ज़्यादा potency चलेगा. जितना कम sensitivity होगा, उतना कम potency चलेगा. Like a patient is mentally very intelligent. He can perceive everything very minutely. He feels the pain, very slightest pain, higher the sensitivity. Now you have to prescribe the high potency. A child who is very sensitive in nature, who is very playful in nature, he can do anything. He was very active, a very sensitive child. It requires a high potency. नहीं है कि बच्चा को कम potency दो, high potency दो. And during the corona, I used to prescribe which potency. My experience is that during the corona, all type of the patients with the fever and I treated many of the patients during the corona condition and there I used high potency at that time because all the people were fearful. है ना, डर लगा हुआ था, क्या हो जाएगा क्या हो जाएगा, बहुत सेंसिटिव, छोटा छोटा चीज को पकड़ने लगते थे. So what I thought, no, I should start. It will take a longer time. So I started treating with the 0/7 potency, directly 0 side. And it was 0/7, 0/8 onward. And it gives me a wonderful results, very beautiful results with that. So this is the beauty of the potency. In all the cases, usually when I am not so much confident about the layer of the and sensitivity, I start with the 0/1 or 3. And basically, for the chronic cases, I go to the 0/3 cases. So this is one answer. Anyone another share more about the tubercular myasm? Yeah. What you want to know more about the tubercular myasm? What is TB? इसको कहते हैं राज रोग. राज रोग समझते हैं? आपको काफी सुख मिला, आपको भोग बहुत अच्छा मिला, हाँ, काफी अच्छा मिला. And with this Raj Rog, what happens? You become, the life become very, चलता है. No regularity, nothing is there. Wandering nature, जैसा मन में आया वैसा करो. And this is the tubercular. When the mind started wandering here and there, tubercular patients, वहां लक्षण आपको दिखलाई लगने लगे. The tubercular patients, they want to cross the universe. दुनिया से बाहर चले जा सकते हैं because they are so much wandering nature. They are so much delightful. They are so much exciting persons are there. And what type of the disease will be there? वहां रोग कैसा होगा? वो भी वैसे ही होगा. वो भी वांडर करेगा, कभी इधर जाएगा, कभी इधर जाएगा, कभी सर में दर्द इधर हो रहा है, कभी इधर हो रहा है. So it is wandering in nature. So tubercular are wandering in nature. They are not stable. They are not in a static positions. They are always jumping. They are always walking here and there. And this is the status. This is primary status. And what happens with the tubercular patients when they become more chronic and at the dying stage? So much thoughts about the death. So much now. The life is going to end. Life is going to end. And they become so much depressed. So this is the journey of the tubercular myasm. And with this idea, there are many medicines in your materia medica like phosphorus, calcarea carb. They all are the, they have got the tubercular टेंस. I said टेंस, उसके अंदर में अंश है. टीबी का भी अंश उन सभी के अंदर में है ना. तो इसको हम लोगों को समझने का जरूरत है. So it is wonderful things that you have asked questions like this. Can you have any other questions? I don't. Repetition of dose. Okay, repetition of dose. I say when to repeat. When to repeat? Nice questions. कब देंगे? मैंने पांचों केस में कभी रिपीट नहीं किया. The same potency was there. And in your materia medica at several places in the notes are written that these medicines work for 30 days, 6 days, 1 month, like that. है ना, इतना दिन के लिए काम, duration of. No, it is not true, sir. It was observations. It is only observations. I have treated a case of the cancer with the arsenicum album. Arsenicum, and only 1 dose of the arsenicum album. I carried on the patient for the whole of the year without any change. So repetitions means what now? The question arises, repetition tab kab karenge? Yeah, repetitions is required. Can I tell you a story? In the playground, you make a kick to the ball. खेल के मैदान में बॉल को एक किक करते हो. तो जब बॉल को किक किए तो क्या चलता है? बॉल रोल करता चला जाएगा, है ना. डू यू रिक्वायर एनी किकिंग देयर? नो. उस पर तो आप फिर से किक नहीं ना करोगे. लेकिन कब किक करोगे? जब बॉल एक जगह पर स्टॉप हो गया और फिर वो आगे नहीं बढ़ा, तब वहां पर किक करने का जरूरत होता है. तो कहते हैं there is no definite time because every constitutions are different, every constitutions are different, everything are different, सभी कुछ अलग अलग है ना। तो ऐसे में एक जगह पर कोई फिक्स नहीं है कि आज इतने दिन के बाद में रिपीट करो, इतने दिन। ट्राई कीप ऑन ऑब्जर्विंग द प्रोग्रेस ऑफ द पेशेंट। क्या मेरा ये पेशेंट का जो काम दवा काम कर रहा था वो करना रुक गया, आगे नहीं बढ़ रहा है, आगे नहीं बढ़ रहा है, तब यू कैन थिंक अबाउट द रिपीटेशन ऑफ द रिपीटेशन ऑफ द yeah. So any other? I think tubercular, I have repetitions. Any other questions you have? Anyone wants?
Does anybody want to ask any question?
I'm very happy in answering questions. I like questions and I love questions.
Okay. A very good afternoon to one and all. It's my privilege and honor to propose the vote of thanks on behalf of my college, Ghmch Homeopathic College, on this today's enlightening webinar by Dr. M.K. Sahani sir. My heartfelt gratitude to you for taking time from this busy schedule of yours to share your profound knowledge with us. Sir, your talks has truly broadened our understanding and dynamic concept of miasm. Right from the historical evolution of the theory, the comparisons, the psychological behavioral dimensions, and the cases you have discussed with us. This has inspired us to look at the disease and its evolution through a more holistic and wider way. Thank you so much, sir. And I deeply thank to our President, Dr. Kanchan Desada Madam, for her constant guidance and encouragement in organizing such academic sessions for us. Our HOD, Dr. Bansori sir, organizing committee, and my thanks to all the participants, all the faculty members, and the students who are attending this webinar with keen interest. Thank you once again to be a part of this enriching event. Thank you. Have a wonderful day ahead. Thank you so much, sir.
After your thanks, there was one question on the chat box. Relationship of susceptibility and potency. I think susceptibility that I have already answered according to the higher the susceptibility, higher the potency, lower the susceptibility, lower the potency. This is the answer only. I have already talked about it. So thank you all for giving me this opportunity to be the part of your DKMM. I had this Jalna homeopathic medical group. I was there in the college long back when it was in the formative stage. Nowadays, it must have grew up a large scale under the guidance of Dr. Kanchan Desada Madam and the Yogesh Desada also. The whole family is very close to me. I'm grateful for them for their so much interest in propagating the education. I feel that this college will become one of the excellent college in our country in providing this type of inviting this type of the academic lectures everywhere. So thank you all. Thank you very much for your patience hearing, and thank you, madam. Thank you, all the directors and the faculty members and all the students who were there in this seminar. So with this, we come to the close of the session, and we are closing the sessions just by. Thank you. Thank you very much.
Thank you so much.
Thank you, sir.